Endoscopic full-thickness resection, eFTR, of colorectal lesions. Results from the Dutch colorectal eFTR registry. Introduction. Endoscopic full-thickness resection, eFTR, is an emerging innovative endoscopic resection technique for complex colorectal lesions. With the advantage of enabling a transmural resection, eFTR offers an alternative to radical surgery in lesions considered incurable with current resection techniques such as endoscopic mucosal resection, EMR, or endoscopic submucosal dissection, ESD. In clinical practice, the main indications for eFTR are non-lifting lesions with severe submucosal fibrosis, lesions that involve difficult anatomical locations such as the appendiceal orifice or diverticula, and subepithelial tumors. Furthermore, eFTR is gaining interest as a valid diagnostic and therapeutic treatment option for T1 colorectal cancer, CRC, as it can provide high-quality pathological specimens and exact histological risk assessment. Several studies have reported encouraging results on the short-term safety and efficacy of eFTR for numerous indications. However, firm conclusions on clinical results will require analysis of large prospective series of patients in everyday clinical practice. Since the introduction of the full-thickness resection device in the Netherlands in 2015, Zwager et al. Started a nationwide prospective registry of all consecutive eFTR procedures to monitor patient outcomes and further increase knowledge on clinical applicability and safety. In this prospective observational multicenter study, the authors aimed to evaluate the technical and clinical success and safety of eFTR for colorectal lesions in current clinical practice. Background. Endoscopic full-thickness resection, eFTR, is a minimally invasive resection technique that allows definite diagnosis and treatment for complex colorectal lesions 30 mm or less, unsuitable for conventional endoscopic resection. This study reports clinical outcomes from the Dutch colorectal eFTR registry. Methods. Consecutive patients undergoing eFTR in 20 hospitals were prospectively included. The primary outcome was technical success, defined as macroscopic complete en-bloc resection. Secondary outcomes were clinical success, defined as tumor-free resection margins, R0 resection, full-thickness resection rate, and adverse events. Results. Between July 2015 and October 2018, 367 procedures were included. Indications were difficult polyps, non-lifting sign and/or difficult location, N equal 133, primary resection of suspected T1 colorectal cancer, CRC, N equal 71, resection after incomplete resection of T1 CRC, N equal 150, and subepithelial tumors, N equal 13. Technical success was achieved in 308 procedures, 83.9%. In 21 procedures, 5.7%, eFTR was not performed because the lesion could not be reached or retracted into the cap. In the remaining 346 procedures, R0 resection was achieved in 285, 82.4%, and full-thickness resection in 288, 83.2%. The median diameter of resected specimens was 23 millimeters. Overall adverse event rate was 9.3%, N equal 34 of 367. 10 patients, 2.7%, required emergency surgery for 5 delayed and 2 immediate perforations and 3 cases of appendicitis. Conclusion. eFTR is an effective and relatively safe en-bloc resection technique for complex colorectal lesions with the potential to avoid surgery. Further studies assessing the role of eFTR in early CRC treatment with long-term outcomes are needed.